Thank you, Mr. Chairman. Despite the success of Medicare Part D, CMS proposed a rule last month that would threaten the health and well-being of our most vulnerable seniors, those with mental illness. Now, having authored the Helping Families and Mental Health Crisis Act, which is H.R. 3717, co-sponsored by many members of this committee, it codifies protected class status for antidepressant and anti-psychotic medications. And having written to Administrator Tavenner on this issue last month, I'm deeply concerned that the agency's proposal will have huge unintended consequences. Now, this is not one of cost saving or convenience. It's not about swapping generic and brand drugs. Apparently, a panel is what advised you on making these changes, and some consultant. Do you have a list of the panel members who made this decision?
We can provide it. They were CMS career physicians and pharmacists.
Psychiatrists?
I don't know, but I can check for you, sir.
I see. I would think that psychiatric medication, some decisions will be made by psychiatrists. So these are career people, so they work where?
Within CMS, but I want to also clarify.
Are they practicing physicians?
Not sure, but one thing I want to make also clarify is that our analysis is on the web. We propose this change in an open way, and we understand this.
No, I read the analysis, and it does not say who did it, and it has very limited things. So let me offer you something. So is it true that in terms of the proposed rule, there was things from an APA practice guidelines that said the effectiveness of antidepressants medications is generally comparable between classes and within the class of medications. Do you know that's what the register wrote? Are you aware of that?
Yes.
Okay. Is it your view that drugs covered in Medicare Part D, 6 protected classes, are interchangeable?
I think our clinical review is that some of the drugs are today.
No, I didn't ask. I said, let me go on. Did you validate your findings with the American Psychiatric Association?
We propose these changes in an open way. We are going to listen very carefully to comments from all medical societies,
including the National Association on Mental Illness?
We will.
And the National Council for Behavioral Health?
We will work very carefully with both the clinical patient communities to ensure that our.
How about the National Institute on Mental Health?
We are happy to meet with all stakeholders.
Now, I have in my hand a letter here from the American Psychiatric Association, and I want to read you a couple quotes from this. It says, "We find it particularly disturbing that CMS used selective and improper references to APA treatment guidelines as justification for limiting coverage of these medications." The letter goes on to state, "The selective quoting from our guidelines and flawed clinical logic apparently led CMS to conflate the supposed interchangeability of drugs within the classes of both antidepressant and antipsychotics with overall evidence for efficacy, when this is just one element of a drug's appropriateness for an individual patient." Were you aware that CMS selectively quoted from the APA?
Well, I think one of our principles, sir, was to make sure that we.
Yes or no? Are you aware?
We wanted to make sure that that our analysis was public, detailed.
I see. There's a letter in front of you. You have that letter?
Yep.
As a highlighted section?
Sure.
Could you read that out loud?
CMS also cited the APA treatment guidelines in support of its claim that there is a lack of unique effects for distinguishing individual drug products when initiating drug therapy, and that treatment guidelines generally do not advocate preference of one SSRI drug over another for initiation of therapy. CMS's conclusion is not supported by the evidence it cites. It misinterprets and misrepresents APA's clinical practice guidelines multiple times as justification for limiting patient access to medically necessary products.
Exactly. So it's important. I mean, you're going back to them for comment, but you didn't listen to them in the first place. Do you know what an SSRI is?
I have been advised.
Do you know how long it takes for one to take effect?
Not personally, but I've been advised.
About 2 to 4 weeks. And yet there's a standard here, but doesn't have an impact on someone's hospitalization with 7 days. It can be disregarded. Do you know that according to the National Alliance on Mental Illness, that seniors who die by suicide, 20% of them do it the day of their doctor's appointment, 40% the week of their doctor's appointment, and 70% the month of their doctor's appointment? The psychiatrists and their patients know that not all medications are created equal. Each one is in a different therapeutic, within a therapeutic class, have different molecular makeups, different side effects, different drug-drug interactions. They impact a person's brain in unique ways, which is why physicians and patients with serious mental illness often try different therapies until they find the right one that works. If you restrict access to these drugs, you restrict the treatment of mental illness. You impact increasing hospital stays. You raise suicide rates among a population that has an increased suicide rate once people reach 65. And you restrict and you forbid the use of life-saving drugs. On behalf of the mental health community, I urge CMS to reconsider, because senior citizens with schizophrenia, bipolar illness, or depression, this is a matter of life and death. So I want to ask you, will you commit to removing this unscientific, callous, and anti-medical decision that will lead to harm for seniors with mental illness?
Sir, I will commit to making sure that our policy is right for patients.
Sir, you are not a physician. You are the people's worst fears. You have no background, no education, no training, and it sounds like the people in this panel are not practicing physicians either and not psychiatrists. You are practicing medicine without a license. This cannot stand for people who are at high risk for depression and suicide and mental illness. I urge you to go back and remove this rule. Thank you. I yield back.